Hey guys, Anya here again with Companion Health to talk about part 2 of the thyroid. So we talked last time about the thyroid and how it interacts with the brain, and specifically thyroid hormones and some thyroid antibodies and how the adrenal glands and cortisol can affect that. Today we're going to talk a little bit more about thyroid functions, how those functions can get disrupted from outside sources, some medication, and some supplement options. So thyroid has essentially metabolic functions when I get down to it. It can affect multiple systems, so gastrointestinal, specifically in what we call intestinal mobility, so how well your bowels are moving, your hair, skin, nails, bone density, specifically related to calcitonin that comes from the thyroid gland and calcium in the blood, and then also calcium deposition in the bone. Hormonal, so a lot of times women will see their periods get abnormal or maybe fertility is affected. There's some immune functions, and then also there's a lot of cardiovascular functions, so specifically cholesterol, blood pressure, heart rate, etc. So how can that get disrupted? So there are a lot of different things, but just a few examples. So if there are food allergies or food intolerances, which again, in functional medicine, we talk a lot about how the gut and the immune system is related to those potentially getting increased. But anytime there's food allergies or sensitivities or anything like that, there's going to be inflammation as a result. So obviously inflammation, infection can disrupt some of the thyroid function. Stress, which we touched on last time, and stress and cortisol being upregulated can affect how that thyroid functions and how those hormones are being produced. Sleep deprivation, changes in the gut microbiota or the gut biome, so those bacteria, aging, heavy metals and toxins, and then physical and emotional trauma are some of the big ones. There's obviously several other things that can affect thyroid, but those are kind of some big ones. So in terms of medication options, there are actually a lot of medication options, both on the synthetic and the natural side. So one of the big name synthetic ones is a brand name medication called Synthroid. The generic name of this is something called levothyroxine. This is a synthetic version of that T4 hormone. Back in the day, it used to have gluten in it, and now there's been this big push for gluten-free. So most, if not all, of the thyroid medications are gluten-free at this point. So if gluten is an issue, don't worry, you're good on that front. There's a medication called Cytomel, or liothyronine is a generic name. That is the synthetic version of T3. Now, depending which provider you see, they may be all about the synthetic side, they may be all about just using T4. But if you remember last video, we talked about most of T3 comes from conversion of T4, where there can be issues, whether it's an autoimmune disorder or the adrenal glands or some other things that are disrupting that conversion of T4 to T3. And so if you give somebody just that T4 and they aren't able to convert very well to T3, and remember T3 is the active hormone, T3 is the one that is the most important in the body in terms of functionality, then they're not going to do very well on just using a T4 medication. There are some people that do well and they convert well, but it's important to really pay attention to how you're feeling on these medications and what your levels look like, and looking at all of those levels. Now, a lot of times we will use what's called desiccated thyroid hormone. I believe myself and Dr. Hori both kind of use this preferentially. Now, if somebody comes to us on Synthroid or levothyroxine and they're doing well, we'll leave them on it. We have no issue with it. That said, most people tend to feel better on this desiccated thyroid hormone. When I say desiccated, it's desiccated, usually porcine or pork. Sometimes there's beef in there as well, actual thyroid gland. So it's a combination of that T4 and that T3. It's approximately a 4-to-1 ratio, so 4 being the T4 and 1 being the T3, generally speaking. And that combination of the medication, of those two hormones, people tend to feel better on it because not only are they getting T4, which is the kind of that pro hormone to T3, but they're getting some of the actual active T3 as well. So they will get relief from a lot of their symptoms. Most of the time, fatigue being the big one, people actually feel better. from the actual combination hormone. So a couple brand names of that, NP thyroid, we tend to, I think, use that one probably the most. NP thyroid is dye-free, gluten-free, it's lactose-free. Armour thyroid is another big name. They're very similar. Now there's another one called WP or Nature Thyroid that was out for a while. There was a big surge. There were some production issues, and I think they're kind of back in the market. It's important to note that while they are also desiccated thyroid, they are the same combination of 4:1 ratio. Both of those do contain lactose, so if there's a dairy issue or a lactose issue, those probably wouldn't work well for that patient. There is also the option of doing compounded hormone, and you can basically, the advantage of that would be like somebody isn't doing well on specific doses, you can actually make a very specific dose for that person. You can also formulate those in an injectable form and also what we call a troche, meaning it dissolves in your mouth. So if somebody has some issues in terms of intestinal issues or they aren't able to absorb the medication well, you can look at alternative options for that. In terms of supplements, there are some supplements, vitamins, minerals that are helpful for thyroid function. Selenium and iodine, those are important in production of T3 and T4 and some of those metabolic processes. However, it's important to understand the function of those, and they are not always the right thing, especially if there are some autoimmune disorders, whether it's Hashimoto's or Graves'. So it's important to check those levels and check those antibodies before starting those supplement options. Zinc, iron, vitamin D, and vitamin A are also important for thyroid gland function. Those are a little bit safer to use. It's still important to understand what's going on. Now, all of that being said, it's very important to fix the adrenal glands first. If the adrenal glands are struggling to function, or they're overproducing cortisol or underproducing cortisol, depending on what's happening with that, if you treat somebody with thyroid hormone, they can actually potentially make them feel worse, and those worse symptoms just depend on if they have low cortisol or high cortisol. So if you have any questions, leave a comment, let me know, and I'll do my best to answer you. Thanks, guys.